So this is one of my favorite surgeries to perform. This is an upper eyelid blepharoplasty with a lower eyelid blepharoplasty. So this gentleman in the upper photo, you can see the heavy hooded appearance of his upper eyelids. He's using his brows to compensate, to try to get that skin up, but not succeeding because of the amount of skin. And a little bit of extra fat up there too. Now with the lower eyelids, he had significant eyelid bags and then also some extra skin because of that, and also just due to age. So the goal of this surgery is just to restore the natural contours of the face, so to get rid of the bulge right here, which then accentuates this hollowness below. So with the lower eyelid, it should just kind of naturally just transition into the cheek. Now he still has a little bit of hollowness down there, and that's normal with age as well, as our face starts to pull away from the eyelid, the cheek junction right here. That can be masked for people that care with some fat, sometimes some filler, but for people just looking to look age appropriate, just to get rid of the bags under their eyes, simple removal looks really good in a lot of patients. The scars hide really nicely. I was able to keep his eyelids in the same position. He has a natural amount of a little bit of white showing underneath his the colored part of his eye, the iris, and that's just his normal appearance. We didn't want to change that, and so I kept the eyelids in the same position, did tighten them a little bit just so they didn't have any problems with that skin pulling down. So some people come in for very subtle blepharoplasties where the before and afters are very subtle. Some of the blepharoplasties are very dramatic, like in this patient. In fact, after his surgery, he said, "Ooh, I'm going to make a great before and after for you," which he did. He looks great. He looks his age. He looks appropriate. He does not look like he's had plastic surgery. He just looks good. Where the upper eyelid, or the upper photo shows the aged appearance, the lower eyelid photo shows that being removed and looking fresher. So let me just kind of move out of the way there so you can see the full appearance. So he's happy. I'm happy. I'm Dr. David Gay. I'm an oculoplastic surgeon, and this is what I do.